Hello everyone, my name is Jenna Kiley and I'll be presenting my case presentation on cystic fibrosis. Cystic fibrosis is caused by the fibrosis transmembrane conductance regulator. This is also known as CFTR protein. Cystic fibrosis is an autosomal recessive inherited disease caused by mutations in the CFTR gene. The CFTR gene provides instructions for the CFTR protein specifically. And in order to get this, people have to inherit 2 copies of a mutated CFTR gene, one from each of their biological parents. It is important to know the different types of mutations. The only one that I could find was delta F508, and this inhibits maturation and transfer to the plasma membrane of the CFTR protein specifically. When talking about the CFTR protein, it can be inherited in 2 copies, like mentioned before, one from each parent, and these mutations can either be homozygous or heterozygous, and that's really important to know because this specific mutation accounts for 70% of all cystic fibrosis disorders. So this is just a picture of my family pedigree. There's no record of anyone in my family currently having cystic fibrosis or showing symptoms or just being a carrier. But if you are wondering about your family inheritance, genetic counselors are a great resource who can help with consultation and more personalized information based on your family history. The pathophysiology of cystic fibrosis occurs to the mutation in the CFTR gene, like mentioned before. This is a genetic condition that affects the body's mucus-producing glands. So individuals with cystic fibrosis have the mutation, and the mutation leads to production of thick and sticky mucus, whereas the normal person has kind of a thin and slippery mucus. The mucus itself, the thick one, can block airways in the lungs, making it very difficult to breathe and also increase your risk of infections. Having this also can affect your pancreas by preventing the release of digestive enzymes needed for proper digestion. Screenings for cystic fibrosis include newborn screening and carrier screening. And newborn screening is a routine test performed shortly after birth and involves collecting a small blood sample from a baby's heel to check for certain markers that may indicate the presence of cystic fibrosis, whereas carrier screening is done before or after pregnancy to determine if an individual carries CF. And it's typically recommended for those with a family history of cystic fibrosis or those planning to have children. It's definitely important to note that screenings are very important because they help identify those who may have cystic fibrosis or carry the gene early on, and it can help with early on intervention and appropriate modifications for what you can do. The physical presentation of cystic fibrosis, there are many things, but the most that you'll see is a persistent cough, recurrent lung infections, difficulty breathing, poor weight gain and growth, salty tasting skin, and then clubbing of fingers and toes. Moving on to the epidemiology of the disorder, I kind of broke it up into 3 groups. First is the distribution of the disease. So cystic fibrosis is most common in individuals of the European descent, mostly those of Northern European ancestries to get more into detail with that. But CF can affect any race or ethnicity, and with advances in medical care and improved awareness, it's led to better treatment and options for those struggling with cystic fibrosis, whereas the determination of disease mentioned before, sweat tests, genetic testing, evaluation of your symptoms, medical history, that's very important. And then lifestyle factors, this is also a big role in cystic fibrosis, making sure you have a good nutrition plan, making sure you exercise according to that's suitable to you, staying hydrated, taking precautions to not get infected by other things, and really taking care of your emotional well-being. So when it comes to diagnostics related to cystic fibrosis, the most reliable test that I found today is the sweat test, and this looks for saltier than normal sweat in individuals. They say it's the most reliable, and the test is painless. It takes less than an hour, and it measures the specific amount of chloride as well. Whereas doctors could use other tests such as chest x-rays or GI series to check for lung and bowel problems caused by cystic fibrosis. Moving on to all-inclusive evidence-based management approaches, I found that there are several based management approaches that you can take, and these are just a few examples. So making sure you have nutritional support, like mentioned before, a good exercise plan that's suitable to your condition specifically, medications such as mucus thinning medications and pancreatic enzyme supplements to help aid your digesting. Also, airway clearance techniques, so helping to help loosen and clear mucus from your airway specifically, such as high frequency chest wall oscillation. Also, infection prevention, washing your hands, staying away from people who are sick, mental health support, really managing the emotional aspects of living with cystic fibrosis and having access to care. Ancillary support that I found related to cystic fibrosis is respiratory therapy, having respiratory therapists help provide specialized care and education on airway clearance techniques. Social services, they often offer support and guidance in navigating the healthcare system, educational and school support. So this is your school nurses, teachers, special aid. Also, genetic counseling. So this is something we recently learned. So counselors who can help provide information and support for families regarding their inheritance and implications of cystic fibrosis. Transition programs, helping you transition into a smooth shift, specifically if you're a young child suffering with CF and then you're an adult finding different healthcare, continuity of care, and then support groups and advocacy organizations. So joining something that can make you feel a part and provide a sense of community. And then some resources specific to cystic fibrosis, the Blooming Rose Foundation. This foundation was created to give hope to families who are struggling with the CF diagnosis. Boomer Eason Foundation, and this is just fighting and raising awareness for cystic fibrosis and provides many ways to like get involved, and they even cover the cost of lung transplants and cost and travel relocations. They also provide disaster relief for families in the cystic fibrosis community. And then there's a blog by Gunnar Eason, and this is him specifically who is struggling with cystic fibrosis, and there is a foundation after him. There's a specific Cystic Fibrosis Foundation that is just a nonprofit, donor-supported organization which helps control and cure CF. Moving on to ethical conflicts related to cystic fibrosis, making sure you inform the patient of their autonomy. So this is an important principle, having the right to know that the patient can make decisions about their own treatment and care, non-malfeasance, so emphasizing the importance of avoiding harm to them with cystic fibrosis, making sure they know the risk, the odds, the circumstances, and make sure you consider having the patient's well-being. Justice, so emphasize on focus to equal access, resources, treatments, support, regardless of their socioeconomic factors, and then benefit sheets. So healthcare providers making sure they provide treatments, interventions, and support that will benefit the CF, and then making sure that you're improving their quality of life at all times. So implications specifically related to nursing, there's a bunch. A few that I'm going to mention is assess cough for effectiveness, monitor vital signs, assess the chest wall for even chest expansion, assess the client's comfort level, monitor pulmonary function testing, instruct the client on breathing techniques, provide adequate rest, assist in chest physiotherapy as appropriate, assist in the preparation of lung transplantation as appropriate, administer humidified oxygen as needed. And then these are just my references. So just cystic fibrosis is a huge eye-opener, and something that I didn't mention before is I read a book. It's also a movie called 5 Feet Apart, and it's related to two people who have cystic fibrosis in a hospital. And I think that's a really good book as well related to this disease and just gives you another perspective. But I really enjoyed this assignment, and I hope everyone enjoyed my presentation. Thanks.